Hi, I'm Dr. Jeff Cumrow, and today I want to talk about how we go about treating Lyme disease. The first line of defense on Lyme disease is antibiotics, and we actually need those antibiotics to get that bacteria out of there. Now, the problem with this approach is those antibiotics crush your gut. Most people now know that we need to take probiotics and things like that afterward, but there are a lot of things that are needed. It's not just probiotics. So, looking to see what kind of diet is going to work best for you. Looking to see, what type of sleep pattern is going to work best for you, how much water you need, using red light, using some sunlight during the day is going to be an important part of it. But ultimately, it's just putting together a plan that is going to fit exactly what you're suffering from. And how we do that, we take a look at your labs. And from your labs, it kind of gives us an idea of how you're making energy. It gives us an idea of how you're handling certain things, and we put together a picture of what your treatment plan is going to look like. So not everybody's treatment plan is going to be the same, but ultimately it comes down to addressing the gut issues that are going to go with the antibiotic use. It comes down to addressing the joint issues that can come with Lyme, and it comes with addressing those fatigue issues and getting that energy brought back up to the level that's going to allow you to do the things that you need to do. Lyme is a very difficult thing because when people get it, they get it to varying degrees. Not everybody has the same amount of issue with it. So, I have seen people that have just been crushed by it, on the verge of losing their life from it. On the other hand, you see some people that barely have any symptoms, maybe some joint soreness or different things like that. So there is a spectrum of different things that go on with Lyme, and everybody's going to be unique with that. And with that, everybody's treatment plan is going to look a little bit different as well. Ultimately, the way that we tell that you are making progress is by looking at labs and repeating labs. And some of this stuff is stuff that can be done remotely. Not everything has to be done in office. We can make dietary recommendations from afar. We can order labs from afar. We can recommend supplements from afar. Some of the things are going to be a little bit more appropriate to be done in a clinical setting. So, there are different ways of going about this, and everybody is going to have a unique treatment plan for it. So it's not a one-size-fits-all treatment plan. It's something that is guided directly toward you. It is targeted directly toward what you need, and how bad your symptoms are, and how far everything goes depends on how closely you follow everything, how severely you were affected in the beginning, and ultimately the changes that we make.